As this first heat wave of the summer continues, it's important for all of us to be reminded about how to protect our bodies from the extreme heat and the sun. Dr. Ben Brocker from Mercy Health joins me now with some important information. Dr. Brocker, first of all, it is National Hydration Day, so thankfully we have that to help us be reminded. But how should water be incorporated? What should people be drinking, and actually how much throughout the day?
Right. It's a great question. You know, the 64 ounces is somewhat of a misnomer. Usually what I tell patients is you want to drink half an ounce per pound. So if a patient weighs 150 pounds, I usually recommend 75 ounces. But truth be told, everybody's different. Everybody's body is different. Usually what people should do is look at their urine. If you're well hydrated, your urine is usually a pale yellow color.
Okay. And is there too much water? Is that possible? And how much is too much if people are drinking maybe a little too much to stay hydrated?
So again, I would tell people look at the urine. So if the urine is clear, there's no like yellow hue to it, and they're urinating frequently, probably, once an hour, once every 30 minutes, I'd say, okay, you're drinking too much water.
Got it. Now for people who like the sports drinks, maybe they choose those, maybe they're playing sports like Gatorade, how much of that do you recommend for people?
It's kind of tough. When I talk to patients, I usually tell them, if you're going to drink Gatorade or something like that, sports drink wise, ounce per ounce. So if you drink, 16 ounces of Gatorade, make sure you're drinking 16 ounces of water with it. I usually don't recommend sports drinks unless you're doing something like, outside playing basketball, doing a sport. Or if you're excessively sweating, then I'll recommend a sports drink, because again, when you sweat excessively, you're losing, those electrolytes. So you need to replete those with the sports drinks.
Got it. Now, after so much rain that we've had, people might be outside more often now. It is warm, but people want the sunshine. We haven't had enough. So let's talk about sunscreen reminders, also how often people should be reapplying.
Right, so the dermatology recommendation is an SPF of 30 or above. If you're at 30, usually you have 97% coverage from the sun, and you want to reapply every 1 to 2 hours, And I tell patients too, as soon as you get out of the pool, if you wipe yourself off, reapply then too.
Good reminder for that. Now, another question, because we're spending more time outside and even a little bit of time if you're working, what's the difference between heat stroke and heat exhaustion? How can people avoid that too?
So the truth is, it's very hard to differentiate between the two. So I can tell you heat stroke, the reason why it's called heat stroke is because it's like people are having a stroke. They are altered, they're disoriented, they're not acting themselves. Sometimes they can't speak, they have slurred speech. And so really, it's like they're having stroke-like symptoms. And if that's the case, they need to get to the emergency immediately.
Okay, and people who are avid runners, let's say you want to exercise and you like to get your fitness in, what are the best times of days to do that? And can you do it in the evening and the morning, or should you just pick one?
It depends on the athlete. I'd say ask your physician if they really want to know the answer. But from my standpoint, if I were to run, I would say I'd probably run early in the morning when it's, the coolest out.
Okay, great advice as always, Dr. Brocker. Thank you so much for taking the time to join us as we go through this summer heat wave.
Yeah, of course.